Here at the Pediatrics program at Staten Island University Hospital, I think what makes us unique is this sense of community that you feel immediately.
The compassion starts at the top in our program here and works its way down to the residents.
They really made me feel like I belong.
I'm Cynthia Chang, the Program Director of the Pediatric Residency Program here at Staten Island University Hospital. My main role here is to make sure that every pediatric resident comes out of the program with an excellent education and training to become a general pediatrician or a subspecialty of their choosing.
The program really provides trainees experience in a wide range of pediatric disorders.
We have almost every subspecialty within pediatrics represented. And what's wonderful is that you get exposed to every single subspecialty, but you do that in such a way that you really get to know the attending because it's such a small program.
So I started at Staten Island University Hospital in the Department of Pediatrics as a medical student. I came on as a resident, stayed as a chief resident, went away for fellowship, and came back as an attending because this place feels like home to me.
Our residents receive their inpatient pediatrics experience here at Staten Island University Hospital, and that includes rotations on our pediatrics unit, our pediatric ICU, as well as newborn nurseries and neonatal intensive care unit. Our faculty have education and teaching as part of their DNA.
So clinically, I really try to give them a rich experience learning about a very high-risk population, and that's an experience that not every resident at every other program has.
As a pediatric intensivist, I do a lot of simulation in our simulation lab.
We have a robust community and advocacy rotation to really connect with people in venues outside of the hospital, because ultimately that's what we need to do as pediatricians.
It has a perfect combination of working in a community hospital, but at the same time, you have access to all the resources and all the support of being part of one of the largest health systems in New York.
As a second year and a third year, you'll go to Cohen's for a month to rotate through their big tertiary pediatric ICU.
And you get to do that in one of the largest PICUs in New York City. It's a wonderful experience. Residents love it after they come back.
In addition to those inpatient sites, our residents spend time in the Children's Emergency Center here at Staten Island University Hospital, which sees in the neighborhood of 20,000 pediatric visits a year, and also time doing general pediatrics ambulatory rotations at our Medical Arts Pavilion right here on our campus. And so our residents get a very rich clinical experience as well as exposure to different social groups.
What makes Staten Island University Hospital a special place to train, I think, is the support we have here.
Our faculty are dedicated to being there for our residents 24/7. All our pediatric residents have the cell phone numbers of the faculty here. They're easily approachable. They always have the residents' back.
In terms of mentorship here at Staten Island University Hospital, we're given a mentor at the beginning of our program, usually based on what our interests are. And I've had attendings come to me that aren't even my specific mentor who have come and reached out about research, and it's been super supportive.
I was interested in adolescents. I was matched with a adolescent attending. It's been really wonderful. They check in regularly with me. They help support me in research.
We provide support for research. We have a dedicated pediatric research and scholarly committee. They will walk the residents through each step, guide them, and help them produce a scholarly activity.
We can say with a great deal of pride that almost every one of our residents at some point during their training will present their research work at a local, regional, or national conference, and most of them graduate their residencies having published an article in the medical literature. We're very excited that in the next year or two, Staten Island University Hospital will be opening its new Women and Newborn Center. This center will include a state-of-the-art labor and delivery suite, postpartum unit, nursery, as well as a new neonatal intensive care unit that will really have all the latest technologies as well as family-friendly space that is so critical in the care of sick newborns.
Speaking as a former resident here and someone who's still very involved in the residency program, I think that this program is unique in that there's such a focus on wellness and quality of life.
I don't think there has been a day where one attending hasn't asked, is everything okay? How are you doing?
And it was immediately apparent that here at Staten Island University Hospital that was important for us all to take care of ourselves, have good social lives, and then we could be really productive in the workplace and learn as much as possible.
There is a work-life balance, and striving to achieve that, I think, is something that should start in residency.
I love my co-residents. I mean, that was truly the number one thing that attracted me here.
I have a great relationship with my other residents, and they're some of my best friends now. I couldn't say more about them. I love them.
I want someone who is passionate about pediatrics, passionate about learning, passionate about really getting in there and affecting people's lives.
What I find rewarding about working with residents is seeing them progress over the course of 3 years. I see their clinical decision-making expand exponentially.
I love watching them find their passion, what they really want to do with their career.
Their success, their joy, that's my success and my joy. That makes me happy.
My philosophy is that my door is open to our trainees. I'm always eager to talk to them, see what's on their minds. I look with great pride at what becomes of them, helping them develop, helping them make career choices.
When you join us, you will not only end up with a top-notch education from dedicated faculty, but also gain a family.
You want to be somewhere where you're happy and that will help you grow into the best physician you can. So that's what I did. I just followed my heart for this one.